everybody, and welcome to this morning's webinar. My name is Paul Margulies from Practice Innovations. And joining me this is Doug Hurlbert, who's our co-presenter. And in the background are Nancy Koval, and Adele Gorgia, Dan Newville, and Ruth Cologne-Wagner, and what seems like a cast of thousands, really, to help us pull together this webinar. And we really welcome you this morning. We look forward to an interesting presentation and most importantly, an interesting discussion online with you. And today's topic, this is really the second webinar that we've done, that we're doing for supervisors within this initiative. And just as a reminder for how this process works, there are 5 different competencies that we're covering in the course of a little bit over a year. And for each of these competencies, there are 3 major events. We start with a statewide webinar for care managers and their supervisors. This introduces the competency and helpful tools. We've done that already. Then we have a statewide webinar for supervisors. That's this. And we focus on identifying strategies for supervising this competency. Then after that, we ask you as supervisors to begin using these strategies. And then we all come back again, usually in a couple of weeks, and we'll be actually doing it in a couple of weeks, for regional online meetings with supervisors, where we focus on how things are going with the strategies, asking you how it's going, what are your accomplishments, what are your challenges, and problem solving together. So that's kind of how the process works. And the agenda for today is we're going to revisit the issue of engagement. Why? Because what we're learning from you as supervisors is that this is essential. And we'll be asking you some questions in a little while to see how it's going. We'll also talk about consumers' complex needs. We'll want to know more from you about your needs as a supervisor. We're then going to talk about supervising engagement and identification of complex needs. We're going to model further understanding on the presentation that Doug did last week. There'll be some case and then we'll talk about next steps. And we'll get all of this done and get you on to your next meetings by 10 o'clock. Learning objectives. We want to identify the strengths and challenges related to engagement of consumers, but also engagement of your managers, because we're well aware of the fact that there's a lot of parallels going on here. That, for consumers to be engaged, care managers need to be engaged. Indeed, all need to be engaged. So we're going to talk about that. We're going to identify strengths and challenges concerning consumers' complex needs. We'll spend some time learning about your needs as a supervisor, so that will help us prepare for our face-to-face meetings that will be occurring not just the road, as well as future online meetings. And then we'll certainly be providing you with guidance concerning supervision competencies. That's the game plan. For this to really be interactive, we're going to be spending a fair amount of our morning with polls. And by having you read the polls, that'll give us kind of information and details to help with the conversation. So we hope that you're willing to participate in a number of polls. Some of these are going to be short answers. Some of these are going to be yes or no's. It'll really help us learn more and really help you share with each other, which, bottom line, is probably the most important part of this hour, is people learning from each other. So moving ahead, we're going to start with the first polling question. And you see a little pod, and throughout this hour, you're going to see this pod popping up on your screen. And what we're asking you is to provide an estimate. And we know of the percent of consumers who are now engaging and following up with care managers. So spend a moment or so. So we may be having some technical difficulties with the actual pod. We'll give it a moment and see if it can unfreeze. Okay, one thing you can do is you'll see a little scroll bar. You can scroll down and you'll see the other possible responses. I see a number of people have done that already. We'll give you another moment. so the question, just to be clear, is of the individuals that care managers are in the process of connecting with, how are they doing around engagement? Okay, so let's see if we can share the results, if that's possible. If not, I'll read them. I'll read them anyway. And basically what we're seeing is that there's a wide range of responses. Most of the responses seem to be falling in the 25 to 49% and 50 to 74% range. And then there's some folks, some larger numbers, some numbers above that, and some below that. But it seems if we can average this out, probably about half the individuals are engaging, it would appear. Okay, let's move on, please. The next question is, so what are care managers doing well that's contributing to successful engagement? And this is a little short answer. You can type into that box there where it says type your answer here. When it's going well, what are they doing? What are your care managers doing that are really helping the process? And we'll give you a moment, give you a minute or so, and then we're going to share the answers. Don't be bashful. Please feel free to type up. Another 30 seconds. Lots of answers. This is good. Okay, let's share the results and we'll read some of them. And these are a lot of ideas. And the purpose of this kind of poll is really for us to learn from each other. So if you see some ideas here that you haven't thought about that can really make a difference, please make a note of them. So here are some answers. Meeting with consumers where it is comfortable for them. Increased frequency of phone contact. They attend to the people we are engaging and are genuine in saying that we will do what we can to do to help them. When clients do respond to outreach, managers are able to respond in a timely manner. Linking to services, housing referrals, medical connections, assisting. So basically those linkages are making all the difference to some. Person-centered approach, meeting people where they are. It's the second time we've heard that. Going into the community. Locating people and thoroughly informing them about the benefit to them of funding and care management. So that early kind of process is important. Where we are. Provide support to consumers. Becoming care coordinators, not case managers, and that's really so much of what we've been talking about already. Locating people and thoroughly informing them about the benefits. Another, providing linkages and support. They're successful establishing rapport. Consistency of contact. Being persistent and patient, which we probably should bold and highlight. Person-centered, quick follow-up after outreach and engagement. Meeting with clients, and let's bold this one as well, and talking about their needs, meeting them where they're at. So we're seeing some messages here that a number of there's some themes here that are very important. Thank you. Let's move on. Another polling question. So when it isn't working out so well, what are the challenges? Please take a moment and type up that little box there. What are the challenges? Give you about a minute. More seconds. lots of answers here. Okay, share, and I'll read some of them. Starts with unable to locate consumers, and I know that shows up in several of the answers here. Transportation barriers, some drug use. Consumers are not familiar with the process of care management and at times are not used to someone checking in on them. So that's kind of an orientation issue. Not having correct contact information, not being able to find people. Some clients are wary of letting other people in their lives. No phone. Transportation, that keeps showing up. Frequent crises. Addresses and updated telephone numbers. One person mentions not being a good listener, so we can understand how that can really handicap engagement. Difficulty making contact, inaccurate information. Okay, I'm not going to read each and every one of them, but what we see here is a couple of things. One is just the info that's being provided, at least in some cases, isn't up to date or accurate, so it's hard to find the people. In other situations, there are transportation issues. In other situations, it sounds like it might be skills, around engagement skills, or other things going on with the individuals. Okay, lots of reasons why. Let's move on, please. When there is a lack of engagement, is there anything that the care managers can do differently? And once again, the idea here is let's do some sharing and learn from each other. Getting some good answers here. Give me another 30 seconds and we'll share. And the concept here is absolutely, there may be some systems issues like inaccurate information that are contributing to the problem. But there also may be things within our control, within the care manager's control, within the supervisor's control that can also help with that with engagement. That's what we're trying to get a handle on. Okay, let's do some sharing. We'll share what people have written. So what can care managers do differently? Increase contact attempts and ways they are attempting to contact. Reaching out to the client's counselors if they have one really helps. So pulling in other people in the network. The counselors need to be, the care managers need to be strength-based. Need to approach in the way that we are here for them and their needs, and we are not here to tell them what, how, and when to do things. So that's really about being person-centered. Thank you very much. I think you're absolutely right about that. Sincerely seeking the present motivation of the client despite our agenda. Other words that are saying basically the same thing. You're on the money with that. Let's see what else we have here. Utilize significant others to engage. Schedule to attempt visits during after hours. Or weekends. Find out what is important to your client, that person-centered piece. We meet in pairs initially and then base assignments on whomever the person gravitates towards. That's really interesting. That keeps the door open. Use contacts in the community to locate. Adjust hours. That's the second mention with that. Meet in a different environment. That's the least mention we've had of that. Work together to get creative so the team of care managers can do some brainstorming. That's really a nice process for supervision. And search for alternate contact info. Talk to clients about the lack of engagement and see if they need positive dealing. Utilize significant others. Try another person on the team, patients. Okay, so I'm seeing some themes here. Some very important themes that are showing up in a number of your comments here. And a lot of it has to do with being person-centered and not pushing our agenda as much as listening to what's important to the individual. A lot of it has to do with creatively involving others in the network, be they significant others in the person's life, other providers, that sort of thing. And a few of the comments have to do with taking a team approach and maybe even trying out a couple of care managers and see with whom the person wants to connect. All very neat ideas. Thank you. Moving right along. How best can you as supervisors with your supervision managers around this issue of engagement? Are we doing all we can for you? Can we help you in some other ways? What you tell us here can help with planning for our face-to-face meetings that will be. So anything you want to share, we'd welcome right now. Another 30 seconds, then we'll share what you have. And please, no request is unreasonable. We really want to learn how we can best be here for you. And since we are beginning our planning for the face-to-face meetings, which will be occurring in about a month or so, we very much want to get your ideas of how we can help you specifically around the all-important issue of engagement. Okay, let's share the results, and I'm going to read all of these. Assist with education about the consumer's mental illness. So are providing perhaps some information to you all as supervisors. Use your clout with the state to get the local DSS people to share information without all the silly legal nonsense. If only we had that clout, but we understand the frustration behind the question, for sure. New practical, tangible steps to implement. It's hard as we all have different approaches, so it's really important to relate to each care manager on a case-by-case basis. Offering different ideas and dealing with care managers that we maybe didn't try, and that's once again why we think it's so important that you are all sharing with each other here, because the brainstorming that comes about now can be just so helpful. Give us new resources, tools, skills for locating individuals. Interesting. Specific tips and ideas from polls and other sources to take to team and discuss. Hopefully we're doing that, and we'll continue to do that. Direct supervision time is limited. Let's see, I just lost that one. Direct supervision time is limited due to all the demands of running an HHCM program and all of the coming initiatives. If there are ways we can help, it would be interesting if we could help you in some way to make the most use of your supervision time. By finding out what are the barriers that we are facing with our care managers, and that's what we're really in the process of trying to do. Integrating the tools better on the electronic medical records with the Medicaid requirements. Outreach and engagement has to be progressive each month. Share ideas about what people are doing month 1, 2, 3 to meet this requirement. So in other words, come back to this conversation over and over again. I think it's a great idea. Thank you. Let's move on. So this question is a little bit different, and this is about care managers. And a percentage of folks who you feel maybe are not engaged or committed or are struggling with the newly defined role of care manager as opposed to being a case manager. Just want to get a little handle on this. Because once again, the idea of a parallel process, that if there are issues with care managers, they in turn will certainly cascade down into becoming issues with consumers. So what percentage of the care managers that you're supervising are struggling with the new role? Perhaps aren't engaged, aren't committed, don't get it. We'll give you about another 30 seconds to respond. Okay, let's show the results, and they're actually pretty encouraging. About half of the respondents are saying 10% or fewer are struggling or not engaged or committed. That's wonderful news. And then the next largest group is 11 to 24%. As we get to higher numbers, there are fewer and fewer people. So it sounds like lots of the care managers are really on board and making the decision, especially if they had been case managers before. But there certainly are some folks, perhaps perhaps are struggling a little bit more. And that's really good for us to know and good for you to be aware of. Okay, let's move on. And same kind of question we asked before, but the care managers. What are the challenges that lead to a lack of engagement of the care managers? For those, and we see there are small numbers really, but for those that are having trouble engaging in the new role, what seem to be the challenges that you as supervisors are dealing with? We'll give you a minute. So these are essentially the issues you're running up against as a supervisor and working with what seems like the smaller number of care managers that may be struggling with the transition of the new role. Okay, let's show the results. We're seeing some themes here. Limitations with time, caseload size, documentation. Clients say they're not interested in the care manager, may be too eager to close that client. So that clearly can be something supervision can be helpful around. Clients going through crisis after crisis, too many hospitalizations, emergency rooms to follow up on. So that becomes almost a workload issue. Consumers not interested in changing their views about going to the ER. One person mentions not being able to transition from TCM to care coordination, still in the mindset that we need to do everything. And that is clearly a supervisory issue, and it's come up a number of times in the time we've already been working together. The actual difficulty in initially contacting the consumers, safety, changing guidelines, lack of understanding of overall goal of service, caseload side, that shows up a couple more times here. Significant increase in caseloads that's showing up, major theme. Complex cases. Too much paperwork, people getting overwhelmed. Care managers are not willing to let go of old ways, overwhelmed with caseload. So some of this is caseload management, which certainly can become a supervisory issue. Some of this has to do with comfort or willingness about engaging in the new role. Okay, thank you. We're going to move on. Anything you as supervisor do differently with those managers who are struggling themselves to buy into the role or be committed to the role? Things you guys can do differently. Let's take a moment. Getting some nice ideas here. We'll give you about another 20 seconds and we'll share them. Okay, let's share the answers. Discuss in group supervision, absolutely. Try to allow more time to adjust caseload size. Use supervision to outline what roles are expected from care coordination versus case management. That's just such a great idea. So people are really clear on the changes. Have care manager come to me, the supervisor, for assistance or with questions. Provide support, encouragement, and brainstorm on how to make jobs easier. Break down what can do and link them to community resources to help and empower the individual to take charge. Great. Encourage and support change. Brainstorm how things can be accomplished differently. Monitor the caseload each care manager is carrying. have one-on-one supervision to address what the barriers are and work with them on ideas or different ways to address the lack of engagement, validate concerns, acknowledge difficulties with the transition, absolutely, and then help people move on from there. Let's see if what I missed here. Role model, thank you. That's great. Provide information and examples. Meet with staff on a regular basis, provide updates, develop policies and procedures regarding safety, etc. Spend time selling the idea of helping the many, not the few. Great concept. People are responding here. This is great. Ask the care manager what would help them. Do some skills training. Let's just focus again on that issue of, since there's a parallel process here, asking the care managers what would help them is exactly what we want to be modeling they're doing with consumers. Great idea. Try to work individually to help understand new role, provide support and offer recommendations, listen, offer support recommendations, ask the care manager what would help them, do some skills training. I can give support, but expectations do not change. They have to do some career counseling. In other words, some people may not just want to be doing this job, and that may be true. These are really helpful. I want to pick up on that Cheryl Martin sent here, and I think everybody can probably see that chat box. And Cheryl is saying we haven't really received answers about the engagement of the care manager with the supervisor. So we don't have a poll question for that, but if folks can use the chat box that you can see right there and share some thoughts about that issue. I think we're hearing a little bit of it in these responses. I see Cheryl is typing up a little bit more here. But the question is, how can you help your care managers to engage with you? Yeah, we just did get a bunch of those answers. Anybody else have anything else you'd want to add would be very helpful. Once again, this parallel process is so important. Weekly supervision, ask them what they need. There's that process. So you're being person-centered with your care manager. Looks like I can't read it all. Looks like open door policy. If I could carry a small caseload yourself so you are one of them and know their trials. That is a wonderful idea. That's Doug's idea. I like it. Be available and ask what they need from me. Offer assistance with things I can assist with. We're seeing a theme here, and it's really being, reaching out and being person-centered with our care managers. You see if there are other comments I could read. Care managers are where they can come to me, encourage meetings, have an open door policy, reduce on team building, let them know when they're doing a good job, give examples. This will help know where they are. That's a great idea, Rhonda Gordon. That's great. I offer to go out with the care managers. Find that one. We're having a difficult time. This is great. Okay, great ideas. Thank you. We're going to move on. Have quite a bit more to cover, and I want to turn things over to Doug very soon because he's got a lot with you as well. Let's skip this one. I think we've kind of covered already. Let's talk about complex needs. What complex needs are your consumers presenting with? Seconds more. We're seeing, I have one response. I'm sure there are other complex needs people are dealing with. Okay, we're going to share. People are still responding. We're going to share. I see some themes here. Intense mental health, intense physical health, homelessness, no income, no supports, health issues, poverty, transportation issues, housing issues. Substance abuse shows up a lot here. Multiple medical, family, and psychiatric issues with several providers or no providers. Mixture of substance, legal, and housing. Elderly. Unaddressed drug addiction. We're seeing some themes here, and they are complex. Lack of appropriate housing, transportation. Yeah, so when we're talking about complexity here, all these responses are really falling into the areas of people having multiple issues related to mental health, substance use, physical health, other supports such as housing and transportation. Okay, thank you. Not unexpected. Moving right along. Are these needs any different from how your case managers, from what your case managers saw in the past? Is this basically a lot of the same stuff, or have things really changed in a significant way? Give you another 15 seconds. Have a couple of answers here. And there's real consistency in the answers. Okay, let's share. And as you can see, people are saying mostly the same. There are some strictly medical cases, but most people are saying no, it hasn't changed, it's not much different. Larger scale because of larger caseloads. Some individuals have 2 chronic conditions. Mostly the same. Some more medical issues are emerging for some. More siloed in the past. Now one person working on all issues, and that's exactly what we're hoping for. And the issue of no, but we were able to provide services ourselves, which we just can't do anymore with this, and that with the size of the caseloads. And that's indeed that shift from case management to care management and use of the entire health home network. Exactly right, and that is the major shift. It sounds like around the complexity of the cases, most people are saying it's kind of sort of the same with maybe a little bit more medical added in. Interesting. Okay, thank you. Let's move along. We're going to probably skip some of these polls. Let's skip that for now. Very quickly, supervision. Care managers need certain competencies. Listening skills. And I'm going to skip the polls related to these because I'm mindful of the time. I want to make sure that Doug gets to provide all of the important information he's going to provide. Then there's the ability to meet people where they are, not where we want them to be. And we've talked about the patient activation measure, which is related to levels of activation and stages of change. Of course, the cultural activation prompts. I'm going to skip these polls for the moment. Here are the PAM levels of activation, and this is going to be very important to keep in mind, especially to prepare you for Doug's presentation. So there are, these various levels of activation, starting to take a role, building knowledge and confidence, taking action, and maintaining behaviors. So let's take a look at polling question number 15. This is a good one to do. What percentage of consumers working with your care managers would be assessed to be at each of these levels? Just if you have any sense of it at all. We'll give you about 30 seconds. Okay, let's share the results, and they're interesting. Not unexpected, but interesting. The great majority are starting to take the role or building knowledge and confidence, the earlier levels. But there are clearly others who are taking action, even some maintaining behaviors. Thank you. Let's move along. We're going to skip this poll to leave time. Another competency clearly is person-centered planning, and that I know, and certainly from the responses we've seen so far, that's clearly something that's on your minds as supervisors, both in terms of helping your care managers being person-centered with consumers, and in terms of your relating to your care managers in a person-centered manner. We'll skip that poll. Just a quick review. We're going to probably do this all the time. The essential components of supervision, and we've talked about this quite a bit already. Case presentations, skills training, group supervision, field mentoring, and database supervision. And now I'm going to turn things over to Doug.
Good morning. Am I there? New technology.
I hear you.
I'm here? Okay, great. Thanks, Paul. Very interesting stuff. I just want to make sure I can advance these slides. Yeah, I can. Okay, it's great to be with you all again. I'm assuming a great percentage of you were able to attend the webinar a couple weeks ago. We talked a bit about SCARF and stages of change. While we were presenting that, one thing became clear to us, and as Paul and I were discussing this presentation, that there certainly is an intersection between SCARF and other models, and one that you might be more familiar with is motivational interviewing. So we just wanted to touch on that, building on this idea that, of course, that we can work from our strengths, work from what we know, build on that rather than trying to kind of create something new or work from a deficit sort of way of thinking. So in terms of motivational interviewing in SCARF, you may have actually picked up some of this when you were listening in a couple weeks ago, but obviously the goal is to engage the person, help them move through and to change. The words that we use are critical in both. Both reduce the threat response. You think about resistance or other issues that occur that motivational interviewing is very effective with. SCARF as well is all about reducing that threat response and engaging the person with you. Also, the normalization of ambivalence and the fact that there is a threat response, and normalizing that and understanding that people are coming to us and they're experiencing this, and that's normal. Normal for us for our brain to elicit this threat response, just like ambivalence is normal when making a change. And of course, increasing self-efficacy and choice are important elements of both, and we talked about that in SCARF in terms of how choice is very important, and in terms of autonomy, and then of course self-efficacy across the other domains, primarily status. I also thought it was very interesting, your polling questions. We're unable to pull up the answers right now, so I jotted them down, and my writing's a little poor, but in terms of what's working well, what I found interesting, there was a number of things that care managers are doing, and they all seem to be pretty much relational. So the things they're doing are in the relationship with the client. So being genuine, reliable, consistent, having face-to-face meetings, linking them to service, meeting where they're at. All of those, if you think about it, genuine, for example, is across that relatedness domain in SCARF. So it's creating that relationship, lowering that threat response when someone is genuine and you can relate to that person. Consistency, certainly, with certainty and fairness. So your care managers, I think, are doing a lot that if you use the SCARF model or talk to them about it, you can say, listen, you're doing a lot of this already, and it's just build upon that. I mean, almost like, did you know that you're doing a great job in engaging the person through these things because of reducing their threat response. So, and then I noticed that the barriers seem to be a little bit more sort of concrete. So there are really practical things that are getting in the way of people engaging people, phone numbers, addresses, resources, etc. So that was interesting to me. So it seemed like care managers are really good at relating to their clients. Same for you. It's what a supervisor can do, the validation, getting input. Paul talked about it being person-centered, also across the SCARF domain. Very similar. Team building is relatedness. So if you even think about what you can do in lowering the threat response of the care managers that you're working with, it's a lot of the same things that you've mentioned here. Meeting on a regular basis, having clear expectations really helps with fairness and certainty. Giving them choice, ask them what do you want, what do you need, certainly around autonomy. So when you begin to kind of look at this through a SCARF lens, you see some of the things you're already doing and maybe some of the things you could build on to continue to engage both the clients and the care managers. So we want to do a couple of case examples and how we would SCARF them for you before we close today. So if I can do this right. There we go. So we start with the client as the first case illustration. So someone is in level 3 or activation. So what I've done is kind of take the case example from the webinar and maybe build on that. So let's assume that that person that we talked about in the webinar is really sort of in a previous or an earlier activation level, maybe level 1, that we've, through what we've done and using SCARF, we've been able to move them more to where they're ready to sort of take more action. And we want to help them to build that. So this is a client, if you remember, that had some substance abuse or substance use issues. And so let's see where they're at now. So this client has gathered the key facts, which you asked them to do, and you're able to engage them in that process. Decided to change to something that they definitely needed and wanted. And through your skillful work, you've helped them get some treatment for the substance use and get connected to a support system. But even though they've engaged in these activities, they're still tenuous at times and unsure that they can be successful. So you've identified that the client is in this activation level 3, so they're starting to take action and they're engaged in the process, which aligns also with sort of action stages of change, which we talked about last time. So you know from, I also gave you a worksheet on what kind of helps and holds people back for each stage. So from that worksheet, you know what helps people move forward is having that solid support system, being able to prioritize what are the key activities, addressing any obstacles as they come up, action, not just the end result, celebrating when things go well, the little successes, and learning how to treat when we are challenged and have setbacks, that those are opportunities. So you recognize that this client in particular seems to be focused on outcomes instead of just what they have to do today and taking it a step at a time and really taking stock in what they've done and celebrating those victories. So you want to help them begin doing these things for themselves. So let's look at how we might talk with a client about some things related to this. So with SCARF, if we're thinking about how do we want to talk to them, and across the domains, certainly across status, we want to recognize, if you remember, one of the things that reduces the status threat is noticing that people are making progress, that they're doing well. It's sort of self-efficacy issue, so that you are actually doing things. You are having some success. You're making progress, doing well. So just noticing that, even if it's a little thing, like you made all your appointments, you made most of your appointments, something, you made that appointment, that can all help with status. For certainty, recognizing, and you talked about, I believe it was validating. So in validation here, a validation point here is you know that the process is overwhelming at times. You recognize that for the person. You're wondering if they're wondering if they're even going to be able to do this. And it's new to them, but it won't be for long. Everything that's new is not new forever. So you are creating quick wins each week, and you have a solid plan to keep it going. So giving some certainty that, we have charted a course here, that we know kind of what we're going to do. So let's talk about what we're doing tomorrow. So again, kind of shrinking that down to something more manageable, something that can give them a sense of control. In autonomy, what do you think of the choices you made so far? How do they think it's going? And again, I think that's the choice of language, shifts, and motivation interviewing is key here. What do you think of the choices you have made so far? So putting the control, letting them see that this is stuff that they're doing. These are choices they're making. Is there anything we should add or perhaps modify? So what do you think? And then relatedness. How are they relating to the people in their self-help group? Tell me what you have in common. What have you noticed that be sharing with these other folks that you're meeting? And then fairness. Let's talk about what you want from me to help with keeping you on track this week. So creating some kind of structure, expectations. Let's just make sure we're on the same page with what you want to accomplish. So aligning expectations and getting some input into what that might look like all help with reduce the threat around fairness. Okay, so we also wanted to, as you can, we're leading to with some of our questions today, talk a little bit about how you might work with a care manager as they move through these stages of change, a significant change that they're going through right now, perhaps with their work. So we have a case illustration for a care manager who is sort of in that, thinking about it, maybe taking some action, but not really solid in that yet. Not really sure this is for them, or this is the right way to do things, or this is the best, or maybe even accepting sort of the reality of the situation completely. So you're supervising a care manager that is in activation level 2 as it concerns changes in how services are delivered in the emerging model. They like how they've done their work in the past, and they've been very effective at it. They realize that the new model is not going away, however, and that they are beginning to see that there might actually be some benefits to the new way, but not really clear or have confidence in how they're going to be able to do this. So you identified that they're in this activation level 2, which you mentioned, and aligns with contemplation or sort of preparation stages of change. So again, back to the grid that we talked about a few weeks ago. Some of the things that help move people are connecting with core motivations. Why are we doing this? Incentives or changes in the environment. How can you make it easier for the person to do these things? Why would they want to do them? And then building confidence by taking some action. So when they do something and it's successful, or they can build on that, noticing that, and then perhaps acquiring a new perspective. So looking and thinking about things a little bit differently. So again, if you take that grid, as we talked about last time, it mentions things that you can that help move people forward. So for this particular person, how might you talk to them and help them move forward? So you want to engage them and help them to be more solid in that action state. They're taking some action, but you really want them to be more solidly there. So how might you scarf it? Well, here's some thoughts about how you might do that. So again, and it looks like that these are some things you can do already based on your responses, but I know under status, for example, change is challenging for you. So really validating and meeting the person. You appreciate the expertise that they have developed over the years. So again, status, you want to recognize that this person has been very good at their job. I just wanted you to know that I've noticed that you attended some of the webinars and you've been offered and shared with me so you can see how some of the benefits have changed. You can really start to see you developing some expertise in a new way now. So it's really hitting on the fact that they were very good at their job before, and you're beginning to see that they're just continuing that, except in a different way now. Certainty. So this is the time to transition again, sort of acknowledging where we're at. And we're going to take this a step at a time. So I'll be as clear as I can about what to expect. I know some of this is new and a lot to wrap our heads around. I'll make it as manageable as I can. So I'm sure that a lot of this stuff is happening fairly quickly, perhaps. And there's a lot of changes. I noticed that like some of your responses, people are feeling overwhelmed. So again, sort of shrinking this a little bit and saying, I'm going to be as clear as I can for you so you know what to expect. You're going to do everything you can to make it as manageable as you can. And autonomy, what do they think? What do you think of this approach? I'm sure there's more than one way to get to our goal and still make our work manageable. There's a lot of constraints, I'm sure, that you work under, but where can we be more creative? Where can we include input and have at least a voice in this process? And relatedness, you're in this with them. the team's in it. That team building is really about building relatedness. I'm sure you notice that many of your colleagues, well, myself, have been where you are regarding this change. Hopefully you're further along than this person. Can I share with you what helped me move forward? So, again, connecting with where they're at and offering them a little bit about, this is what helped me. And in fairness, you seem unsure that this might be the best way for our clients, and even if it is fair to them. I want to clarify with you what our objectives are, so we can, because I know we share a concern for our clients' welfare. So again, it's connecting with what they might be thinking about, and then you want to clarify for them what you're doing so they know what to expect, where you're going. If you have certain objectives as a team or a supervisor, you can clarify those and then work towards those, and they see that connection. That lowers the threat response in terms of fairness. So there's a couple of examples in how you might sort of scarf that, the approach for those two cases. The other thing to think about with SCARF, which I didn't mention, and I just wanted to mention quickly to you today, is that if you've become familiar with SCARF, it also can be somewhat diagnostic. So you can recognize that someone's status, for example, their threat around that domain may be going up, given that they felt very skilled before and now may not feel very skilled at all at what they're doing or overwhelmed. So you know that that might be a hit to their status. So you want to pay real attention to how you talk to them across that status domain, for example, or certainty, autonomy, etc. A lot of these threats are going up currently, not only for our clients, but for the care managers as well. And to be aware of that is normal. But how we talk to folks can help reduce that threat. So I think that's my last slide, Paul. Is that right?
Okay, I believe so. Thank you so much, Doug. That was very, very helpful.
Thank you.
Thank you. I know we just have a few minutes left. We have one last polling question, folks. That is based on today's webinar. What will be one new or maybe newly reemphasized aspect of your supervision over the course of the next few weeks? Just remember, all of this is in the service of supervision. So take a moment, type up, what do you want to focus on the next few weeks? Because when we come back, and we'll show you the times and dates in a minute or so for our online meetings, we'll want to talk about how's supervision going. So is there anything you want to be focusing in on the next couple of weeks based upon what we covered today, or really based upon most anything? Let us know. We'll give you about a minute. Another 30 seconds, then we'll share what we have. Seeing some nice ideas here. We'll give you another 15 seconds, and we're going to share. Okay, let's share. I like what we see here. So one person says, we are in this together, and to really emphasize that. And that gets at really the parallel process, the person-centered process. Another person says the emphasis on care management versus case management and confidence we have in them to make it work. And really, as we heard, somebody had mentioned in today's webinar, really illustrating the differences so people have it crystal clear in their heads of what the case management approach had been and what care management really is, because there are significant differences. Validating the difficulties for the care managers in the changing paradigm and looking for new ways to approach these changes. Wonderful. So it starts with the validation of, yeah, this is reality. Let's work together. Let's do some brainstorming to figure out how to move on from here. Engagement skills? Absolutely. Addressing more focus on my care managers' frustrations that they express to me in supervision, to see if they can reduce some of their anxiety. So really that gets back to the validating, and the purpose of the validating isn't to keep people stuck, obviously, but by validating it helps people get unstuck, especially if it's really pooled with some brainstorming about where we go from here. Review of SCARF with my care managers, wonderful. Just what we were hoping somebody would say that. And now, those are the ideas. Thank you very much. In the remaining minute, we just want to point out the next steps. Implement these strategies. And then we have regional meetings scheduled. Tuesday, May, and these are all from 9 to 10:30 in the morning. Tuesday, May the 5th, that's for the Western and Rochester regions. These are the folks who met in Batavia in February. Wednesday, May the 6th, Central and the Utica Watertown regions. These are the folks who met in Syracuse in February. Thursday, May the 7th, Northeastern and Hudson River regions. These are the folks who met in Albany in February. So those are the next meetings, and we're going to focus largely on how supervision is going, and especially supervision of the topics we've been covering. You'll see on your screen a pod which will allow you, if you would like, to download today's PowerPoint. I'm also going to give you our contact information. And as we're exactly at 10 o'clock, I want to thank Doug for his very helpful involvement in today's webinar. And I want to thank Nancy behind the scenes, as well as Adele and Diane, and I believe Ruth has been behind the scenes. And so thank you all for joining us today. Look forward to meeting with you again in 2 weeks. Take good care.
Thanks, Paul.
Thank you.